Welcome to my SN Pharma online classes. Today I am going to discuss about anti-asthmatic drugs. Before I am going to start about the drugs, first of all we know about the definition of asthma. Here, asthma is nothing but it is a condition in which the person airways become inflamed. Here it means the bronchioles and the bronchi which is present in the lungs, it became inflamed or narrow or swell, and there is a excessive production of mucus which is result in the difficulty in the breath. These are all about asthma. Here, how it is happen? We see the pathophysiology. See, in bronchus, we see the mast cells. In bronchus, we see the mast cells. Here, this is the structure of mast cell. In this mast cell, they contains the granules. Inside the granules, it stored the histamine. Histamine is a chemical mediator for inflammation. Here, what happened in the histamine? It contains granule. These granule which stored the histamine. If there is any type of allergen, is inhaled, here what happened? There is activation of this mast cell which leads to release of histamine from the granules take place. This is one mechanism. And another mechanism is what happened? This is the membrane of phospholipid. This mast cell membrane of phospholipid which is during immunological reaction or during the allergen is bind to the mast cell and activation of mast cell, these membrane phospholipid which liberate the arachidonic acid, and this arachidonic acid is oxidized to either use of lipooxygenase pathway or they are using of COX or cyclooxygenase pathway to form prostaglandin and leukotrienes. These leukotriene and prostaglandins are the strong mediators for bronchoconstriction. If there is a constriction of bronchus, automatically there is a difficulty in the breathing take place. Here, see, here this is the structure of smooth muscles of bronchus. Here this is the structure of smooth muscles of bronchus. Here what happened? Over the surface of the smooth muscles, there is a number of receptors are present. Here, for example, the leukotrienes which is bind to the cis-LT1 receptor which is present in the smooth muscles of bronchus. When it is bind and it is activated, this GQ receptor, LT1 receptor leads to more intracellular calcium level, which leads to increasing in the calcium level. If the more calcium level, automatically there is a contraction of smooth muscle take place. This leads to difficulty in the breathing. Then another one mechanism. Here, histamine which is released from the mast cells of the granules. Here what happened? This histamine which is released and they bind to histamine receptor, H1 receptor, which is present on the smooth muscles of bronchi. This also leads to increases the intracellular calcium level. If more calcium, automatically contraction of smooth muscle result in the narrowing of the airwaves and difficulty in breathing. Next, another one pathophysiology is here adenosine. It is also present in the lungs. What happened? They bind to adenosine A1 receptor which is present on the surface of smooth muscle. This result decrease in the cyclic AMP. It is a secondary messenger which result decrease in the cyclic AMP. If there is a decrease in the cyclic AMP, this also leads to contraction of smooth muscles. Here, and the sympathetic and parasympathetic fibers also here. What happened? The smooth muscles also innervated in the sympathetic and parasympathetic fiber. It means here In sympathetic fiber, the epinephrine and norepinephrine is released from the sympathetic fibers and they bind to B2 receptors which is present over the surface of the smooth muscles of bronchi, and this result in increases the cyclic AMP. If more cyclic AMP, automatically relaxation of smooth muscle. Here, but acetylcholine which is released from the parasympathetic fibers. If there is a more acetylcholine release, it is bind to muscarinic M3 receptor which is present on the smooth muscles of bronchi. Here what happen when this smooth muscle when there is a M3 receptor is activated, which result in increases the calcium level inside the smooth muscle, leads to contraction. These are all about pathophysiology of asthma. Here we see some drugs, how they act on the asthmatic patient. Here, if we see classification, we use the beta adrenergic agonist. Why? Because if the more stimulation of B2 receptor, more increases the calcium cyclic AMP, result in relaxation of smooth muscles. Here hence we use beta 2 adrenergic agonist. They are stimulants. They increases the opening of beta 2 receptors, leads to increases the cyclic AMP and as result in the relaxation of smooth muscle take place. There are two types. One is short acting beta 2 agonist. Another one is long acting beta 2 agonist. In short acting beta 2 agonist, examples are albuterol, levolbuterol. The onset of action is 4 to 6 hours, means the dilation, the bronchodilation from 4 to 6 hours. Then long acting beta 2 agonist, examples are R4-meterol, formoterol, vilanterol and salmeterol. The onset action is 6 to 12 hours. Next, third one is anticholinergic muscarinic antagonist, means they block the M3 receptors. Here what happened? Anticholinergic or M3 receptor blocker, means they block the M3 receptor, means there is no entry of acetylcholine, or they block the M3 receptor, means there is a decreases the calcium, intracellular calcium level, and automatically there is a relaxation of the smooth muscle take place. Examples are short acting muscarinic antagonist are ipratropium, and long acting muscarinic antagonist are thiotropium, aclidinium, omeclidinium. Next is leukotriene modifiers. Here in this what happened, the leukotriene modifiers, the mechanism, the two mechanisms, either here what happened, these leukotrienes, what happened, they bind to leukotriene receptor and inhibit the binding of leukotriene to the leukotriene LT1 receptor, means there is no increases the calcium inside the smooth muscle take place. Here see, this leukotriene modifier, they bind to this receptor and they block this receptor. If they block this receptor, there is no more binding of leukotriene to this receptor. Then automatically what happens? There is decreases in the intracellular calcium level. If there is a decreases in the intracellular calcium level, automatically there is a relaxation of smooth muscle take place. Next, another mechanism is they inhibit the lipooxygenase, which result there is no conversion of leukotriene. It means here what happened, see, these leukotriene modifiers, they block this LOX oxygenase enzyme. If there is a blocking of this enzyme, there is no conversion of leukotrienes. If there is no conversion of leukotriene, means there is no bronchoconstriction take place. It means there is no binding of leukotriene to particular leukotriene receptor. There is no increases in the intracellular calcium level. Automatically relaxation of bronchial smooth muscle take place. Next, last one is phosphodiesterase inhibitor. Here, phosphodiesterase is an enzyme. The main role of this enzyme is the breakdown of intracellular cyclic AMP. But here we need the cyclic AMP for smooth muscle relaxation. Hence, we block this enzyme. If we block this enzyme, there is no breakdown of cyclic AMP. If there is no breakdown of cyclic AMP, there is a more available of cyclic AMP leads to relaxation of smooth muscle take place. Next is omalizumab. Here, this drug is also called as recombinant monoclonal antibody. This drug is mainly bound to IgE. Here, see, this is the IgE antibodies. The role of this IgE antibody, they bind to mast cell. When they bind to mast cell, result in activation of mast cell, which result in the release of histamine from the granules of mast cell. Here, the drug, they block the binding of this IgE antibody to the mast cell. If there is a blocking, there is no activation of mast cell and there is no release of histamine. Automatically leads to bronchodilation. Next, last one, corticosteroids. They are used. This drug is used in the form of combination therapy with the long-acting beta-2 agonist or long-acting muscarinic antagonist or anticholinergic drugs. Here, the main role is these corticosteroids, they suppress the activation of inflammatory gene, or they stimulate the activation, or they stimulate the anti-inflammatory gene. This is about two mechanisms of corticosteroids. These are all about anti-asthmatic drugs. Thank you for watching my video.